Hi, I'm Dr. Paul Steinke from Foot and Ankle Associates of North Texas, and today we're going to be discussing different types of ankle sprains that can occur and how we treat them. The most common type of sprain is called a lateral ankle sprain. It actually occurs to ligaments on the outside of the ankle. These are typically occurring when a patient steps down like off a curb or does a quick cutting movement and their ankle actually twists like this. That puts a tremendous amount of stress in the two ligaments, one being here and one being here. It's most common to damage this ligament. It's called the anterior talofibular ligament. And after an injury like this, you'll notice a lot of swelling in the side of the ankle. You may even notice pain up into the tendons on the outside of the ankle. And when you come to our office, regardless of the type of ankle sprain, be it medial or lateral, the evaluation typically is involved a history of the injury, obviously a history of previous injuries, because people with chronic ankle sprains tend to have worse recoveries or more prolonged recoveries. But also an exam and x-rays, because in some situations you can actually break the bones in the ankle, and that's a more serious problem because it requires surgery in most situations. But in this case, typically a patient will come in, we'll evaluate the ankle, evaluate the integrity of the ligaments with special stress testing, and when we have a sprain, most sprains are mild in nature where the ligament doesn't actually tear. It's a broad ligament here and it basically just gets stretched. Those patients typically will take about 3 weeks of recovery. For patients where the ligament actually tears, where some of the fibers are partially torn, however it's still intact, those patients will typically go through about 4 to 6 weeks of recovery, and that recovery involves bracing, anti-inflammatories, icing, and immediate exercise, especially with physical therapy, because that speeds the recovery process. The last group of patients will actually tear that ligament completely and it will separate. And when that happens, often we're required to put the patient in a cast to allow it to recover. If the patient has previous injuries or had this numerous times or is a high-level athlete, typically we go ahead and fix that surgically right away. Now, in the last 5 years, there's been new techniques that have been created for repair of these ligaments, so patients don't have to be casted for as long after surgery as they had in the past. Typically they'll be in a cast for several weeks and maybe not even at all, just in a boot, and even within 4 weeks are able to hop on one foot so that when they can get back to sport or activity much quicker. The least common type of ankle sprain that we see in our office is called a medial ankle sprain. This one's less likely to occur just because it's a very broad, robust ligament and actually spreads across the whole inner portion of the ankle. This is more typically injured when people have major injuries like car accidents where the pedal comes up into the foot, or they fall from a height like off a roof. We don't see that very often, and typically when we do see those, they don't require prolonged treatment because they're such a strong ligament it tends to heal pretty predictably. So if you experience an ankle injury, please come on into Foot and Ankle Associates and let us take care of you. Remember, you can have more than just a sprain. You could have a tendon injury or an ankle fracture, and left untreated that can cause long-term problems.